Okay. I did get a notification that it's streaming now. Okay.
Yeah. So, welcome to today's talk session. My name is Deidre Moss, and I'm the host of Can We Talk? I'm an educator, a motivator, and a talk connoisseur. In our session today, we will focus and talk about diabetes awareness, as November is recognized as Diabetes Awareness Month. We want to talk about what this means to our community. Today, we welcome Cora Nally. Okay, just want to make sure I got that right.
Yes.
The country's director of Project Hope, Cora Nally, will help us to dissect this topic today. But at this time, I just want to share a brief introduction for Ms. Nally. So Cora P. Nally is an international public health professional and humanitarian worker with 17 plus years of experience in global health. She has lived and worked in 7 countries on 4 continents, including 7 years in sub-Saharan Africa. Cora is currently the country's director for Project Hope in the Bahamas and has been working in Abaco since Hurricane Dorian hit in 2019 to support primary health services and strengthen the health system through an integrative and comprehensive community health worker program. She has a master's degree in public health and is currently pursuing a PhD in health systems from the Ghent University in Belgium. So that our audience has this understanding, now that our audience has this understanding of your credentials at this time, I would also like to pass the virtual mic to you so that you can give us just a brief introduction of yourself. We haven't covered anything in your introduction, just a brief introduction of yourself to our viewing and listening audience.
Sure. Thank you so much for having me today, Deirdre. And no, that was a pretty comprehensive introduction. I have been living in the Bahamas since August of 2019, and I have loved living here and have enjoyed working here as well. It's unfortunate that my job is associated with Hurricane Dorian, which was devastating, of course, for the country, especially for Abaco and Grand Bahama. But it's been such a privilege to be able to work while I was living here, and I'm really grateful for that. I just returned from Abaco actually today, and every time I go back, I'm always so pleased to see how much progress is being made. And everyone there works so hard all the time to rebuild their community. And it's been a real joy to walk in that journey with them.
Awesome. Thank you so much. Thank you for that introduction. And can we talk diabetes awareness?
Yes, please.
And so in your role, let's talk about your role and responsibilities. So can you tell us about your role and responsibilities as the director of Project Hope?
Sure. So Project Hope came to the Bahamas in the days following Hurricane Dorian, as you mentioned, and they first started providing direct health care to people in Abaco, as well as people in Nassau who were staying in the shelters here. We have since transitioned and now have a community health worker program in Abaco and on 3 of the Keys, and we've been working to improve access to health services, extend the health system into the community, and that allows us to understand the needs better in the community, as well as to feed back to the health system things that we're hearing there. We're currently in week 2 of a 12-week implementation that focuses on helping people with a diagnosis of diabetes or hypertension live happier and healthier lives. And so far it's going very well. I should say a few words about Project Hope. So Project Hope was founded in 1958, and it has worked in hundreds of countries around the world. We focus in 5 main areas: disaster relief and health crisis, infectious disease, non-communicable diseases, maternal, child, and neonatal health, and also health policy. So while our role in the Bahamas started out as a disaster response, we have since transitioned to focusing on non-communicable diseases like diabetes and other infectious diseases as well.
Thank you so much. And so what are your thoughts as we look at diabetes awareness and November being Diabetes Awareness Month? What are your thoughts on Diabetes Awareness Month and the level of awareness of diabetes and non-communicable diseases, sorry, that you spoke about that your organization is focusing on? What are your thoughts on the level of awareness of diabetes and non-communicable diseases in the Bahamas?
Um, I, excuse me, I've been very impressed with the Ministry of Health and Wellness focus on preventative, um, raising awareness of NCDs and preventing them as well. When the current administration added wellness to the end of the Ministry of Health name, that seemed to signal to the rest of us that they're going to take a very holistic approach to healthcare, which is really important. 75% of deaths in the Bahamas are linked to non-communicable diseases, which means that a lot of people are dying every year who don't have to. If they have more knowledge, then they have more power and can take more control over their own health. And the awareness campaigns that the government promoted before COVID-19, in-person health fairs and things like that, nobody is doing those, unfortunately, yet. But a wonderful thing about the pandemic has been that more resources and more information is readily available online, like this podcast that you are doing, or sorry, Facebook Live, that you are doing now. These resources weren't necessarily available pre-pandemic, and now even doctors are much more willing to see patients virtually, whereas before you might have to travel from one of the family islands to Nassau to visit with a specialist. Now you're able to make a virtual appointment with some of them. So this is progress, especially in a country like the Bahamas where everyone is so spread out and NASA has so many wonderful resources. This allows the family islands to have more access to them. So I think that awareness is rising in the Bahamas around non-communicable diseases and around the world. And I've been happy to see people curious to learn more and curious to take responsibility for their health.
Thank you. Thank you so much. And I want to thank you for mentioning the fact that the Ministry of Health would have added the wellness component to the ministry. And I think that is so very important. And I want to thank you for highlighting that. And I was just looking that down in the comments, sorry, and I just wanted to mention,
Sure.
to mention our friend James.
Yes.
So he's saying, thank you for featuring our program and the work that we are doing in our communities. Can we talk? And Deidre Moss. So I just want to thank James. He's in the comment and he's watching you.
Oh, okay, that's good. Hi, James.
So again, I want to thank you for mentioning that. I mean, as simple as it may seem, as it pertains to that added component of wellness, I think that is so very important. I think that's so very important. And I want to thank you again for your response to the level of awareness about diabetes and non-communicable diseases in the Bahamas. And so coming off the back of that, are you, as a public health professional, are you satisfied with the response of the community as it pertains to diabetes awareness and the prevention of diabetes in the Bahamas? And just want to say, sometimes, our, I want to say our kind of food culture is a bit kind of heavy with those, those goodies. And so anyway, let me just hear from you before I get into that.
Sure. Yeah, so like I mentioned before, 75% of deaths in the Bahamas are linked to non-communicable diseases. And diabetes is the fourth leading cause of death in the Bahamas. And the three causes above it include stroke and 2 types of heart disease, all 3 of which are linked to diabetes and can be complications of diabetes. So it's a very important and unfortunate health issue in the Bahamas. And Diabetes Awareness Month is important because it draws more focus to that. The last statistics I could find were from 2014. And at that time, the Bahamian government said that 35,000 people in the country were living with a diagnosis of diabetes. So that doesn't include pre-diabetic people. And it also doesn't include the fact that normally half of people living with diabetes go undiagnosed. So if we double that number and add pre-diabetic people, it's likely that more than 1 in 5 people in the Bahamas are impacted personally by diabetes. So it's definitely an important health issue. And we could always benefit from more awareness. All of us could always benefit from more awareness. And I think one thing that is important about this month where we focus on diabetes is that we're offering people the tools to take control of their own health and take responsibility for it. Sometimes it's definitely easier to go to the doctor and have the doctor say, you need to take this medicine, but you maybe don't understand why, and you don't understand the other things that you should be doing in your life to help make that medicine work better. And we all know that the doctors and the nurses in the health system have been overextended and overworked in the last year and a half because of the pandemic. So it's nothing against them at all. They do amazing work every day. It's just there's just not enough time to spend with everyone. So that's where the power of our program comes in. We have a 12-week program, and each week we spend an hour with the people enrolled in the program, and we help them really understand how diabetes works in their body, what the numbers mean when you go to the doctor, and what they can do to live better, healthier, happy lives with diabetes. Um, I Some people are not aware of risk factors too for diabetes, and they'll share with you, something like they're very thirsty all the time, or they're very hungry, or their vision is blurry, or maybe they have numb fingers or tingling feet. And we'll ask them if they had their sugars tested, and they'll say, oh yeah, I was at the doctor 2 years ago and they said my sugars were fine. But if you're having any of these symptoms that I listed, and it's quite easy to Google what other symptoms are, you really should go back to the doctor and be tested again, because the sooner you know you have diabetes, the sooner you're able to make some lifestyle changes and take control of it so it doesn't progress to a point where, unfortunately, I know too many people who've had a foot amputated or who have lost their sight because of diabetes. But all of these acute complications are preventable. If we take that power, we can prevent those things from happening to us and to our family. I think this is an opportunity for everyone to ask questions and everyone to learn and take that power back and, yeah, hold it for themselves and their family. That feels a little scattered, but
Oh, no, no, you're
okay.
perfect sense. And I want to ask you again, you said it so you kind of you mentioned some heavy statistics when you first began answering the question. Could you just please go over them? That's so very important. Can you go over that one more time, please?
Sure. So diabetes is the fourth leading cause of death in the Bahamas, and the three causes above it are stroke and two different types of heart disease. And all of those can be complications of diabetes, and they can also be what we call cousins of diabetes. Just like if someone has high cholesterol, they're likely to also have high blood pressure. Diabetes is also a cousin to these three diseases, unfortunately. And then in 2014 is the last year that we have official numbers for. At that time, the Bahamas had 35,000 people living with diabetes. And as I said, that doesn't include people who are pre-diabetic. And we know that approximately half of people living with diabetes never get a diagnosis. So that number could easily be double, which would put it at 1 in 5 Bahamians are living with this disease, which is significant.
Wow, thank you for sharing that. And that's powerful to hear that even those other diseases kind of have a level of connection to diabetes. And that's definitely something to take into consideration. And I just want to go back to the comments again to Curleen. Hi, Curleen. I can't and this sorry if I get your name incorrect, Damali, I think you are definitely in the wrong section, and you would know exactly what I'm talking about. So I just want to go to another question, and I want to talk about recommendations. What recommendations would you put forward to address the issues of diabetes within our community? We know this is an issue. We know that a number of persons, a number of Bahamians are affected. What can we do? What can we do to address this issue in our country?
Well, one thing I hear from people when we start to talk about nutrition or exercise or movement is sometimes people feel like they're being punished if they're being asked to eat healthy, or they're being punished if their doctor has told them that it would be better for them if they took a walk 30 minutes every day. And it's difficult to change people's perception of that, but what your health professionals are asking you to do are actually things that will make you feel better. If you do walk 30 minutes a day, even just 30 minutes a day, you're probably going to sleep better. Your back will hurt less, your legs will hurt less, you'll just feel better. And the same goes for making different choices when you're eating. And I know that the Bahamian food is very good. It's delicious. But I also know that a lot of it is fried and a lot of it is very sweet. And our bodies actually our taste buds get accustomed to these tastes. So anything less than that, like less fat or less sugar, tastes bad to us because we're more accustomed to sweeter things. But you can actually train your taste buds to become accustomed to a less sweet thing or something with less fat in it. And the way you do that is just by decreasing it just a little bit, every week. So for example, if you put 4 teaspoons of sugar in your coffee and you can't imagine drinking your coffee without 4 teaspoons of sugar, maybe try 3 teaspoons of sugar just for a couple weeks. And then you'll probably get used to that. And then you can cut back to 2. And like this, over time, slowly reduce it. Maybe you end up with half a teaspoon of sugar in your coffee. And then I would challenge you, when you get to that point, to then put 4 teaspoons of sugar back in your coffee and taste it. And I guarantee that you will think of that as too sweet. I can't drink my coffee like that anymore. So our body can learn to like new things. We just have to take it through the process of slowly changing our palate. So it is possible. And it's not a punishment. It's never a punishment. When you're taking care of your body, it's not a punishment.
Absolutely, absolutely, Cora. And I heard you talk about our delicacies, our food culture, right? We have the sweets, the banana bread, the coconut tarts, the pineapple tarts, the macaroni filled with that butter. I mean, we just have all those nice delicacies. How do we, that's a part of our culture. How, like you said, maybe just scale back with sugar. How can we? And a lot of it is fried. That fried fish, that fried chicken. Yeah. What can we do? What can we do? Just scale it back, right?
Well, so there are ways to get the same texture and the same sensation, but without the same level of fat. So for example, with fried fish, if you take the same fish and you bread it, but then you bake it at a high temperature, it's still very crunchy, but then it hasn't been sitting in all that oil, but you still get the same taste sensation. And then the same thing, you can do the same thing with the banana bread and the tarts and everything, is to slowly reduce the sugar over time. Even as a baker, you can start adding, so say for example, the recipe calls for 1 cup of sugar. You can add half a cup of sugar and half a cup of applesauce.
Oh, okay.
And taste it and see what you think. And I would imagine it probably will taste very similar to what it was before, but now it has half the sugar.
Awesome. Thank you for those. There are ways. Yeah. Thank you for those suggestions. you know, because we do love our food. We have our food culture over here. So I just want to mention Susan Sawyer Rogers. She's saying hi to you.
Hi,
Uh,
Susie.
and Vivian from Jamaica. Welcome, Vivian. Thank you for listening in. And she's saying this is a critical topic. And again, I just want to thank you for, just coming in and sharing your insight and sharing your knowledge as it pertains to this topic. This is definitely a critical topic in our country. And so we want to talk about advice. What advice would you give to individuals who might be impacted by diabetes? And what advice would you give to individuals to prevent maybe developing diabetes?
So that's important. And I also want to highlight, because you said something interesting about food that I think is important for us to acknowledge, is that food is very important to families and to cultures. We have a lot of events around food. I'm American, so Thanksgiving is next Thursday. We have a lot of Thanksgiving foods that you have to prepare and you have to eat
Well, we
on
do that here
Thanksgiving.
too. We do that here too.
Exactly.
Yeah.
And by being encouraged to make healthier choices, none of the food will be taken away from you. It will all still be available. We just need to think of different ways to prepare it. And you can still eat all the food, but you can't eat all the food every day. Like, you're not going to eat Thanksgiving dinner every day. But on Thanksgiving, of course, you should enjoy Thanksgiving dinner. Food does play a very important role in culture, which is one of the reasons it's very difficult to change the way that people eat. So one thing that people find interesting is what a serving size is of food. But yes.
That's an excellent, go ahead. That is excellent. Yeah. That's an excellent point. Thank you for mentioning that.
Sure. So a lot of Bahamian restaurants actually do quite a good job of bringing you one serving when you order something. American restaurants don't. They bring you 3 or 4 servings on one plate when you order. So for example, for meat or protein, it's the size of the palm of your hand. So, my hand is quite small, but if my son, he's 17, so his palm would be bigger. So his serving size for protein would be bigger than mine. But my size for protein is the size of my palm. Okay. And even the thickness too. So if you're thinking about a steak, it's this big and this thick.
Oh, wow.
That's the serving size for protein. For carbohydrates, it's your fist. Okay. So not my son's fist, which is probably twice the size of mine. My fist is my serving size for carbohydrates, and that's it. Yeah.
Ooh, okay.
And for fat, it's the top joint of your thumb. That's one serving of fat.
Wow.
Yeah. That's one serving of fat. And then for vegetables, it's 2 hands together cupped. That's a serving of vegetables. Yeah. You can eat lots of vegetables. They're good for you. But not with a lot of fat on them, only just a little.
Oh, wow.
For one serving of fat.
Oh, wow. Yeah. Thank you for sharing that. And again, I just want to look back at our comments. So what can you say to Miss Joseph, who was saying, healthy food doesn't really taste too good? How can we convince these people like this? She said, it seems as though you're punishing yourself. And but Kenny Sweeting is saying the applesauce that you would have mentioned, that is definitely interesting.
Yeah.
But what do you say to people who said, you know what, that healthy food, no, that's not for me. It doesn't taste good.
Yeah. I hear that a lot. I would challenge her to take a recipe that she really likes to make all the time and to make a healthier choice with it. So, for example, just like we mentioned with fish, if you eat fried fish every Friday, instead you can bread it still, like put the egg and the flour and the breadcrumbs on it, but put it in the oven instead of putting it in the oil. Just little changes like this. And you don't have to change everything at once. Changing everything at once doesn't really work for people. We're creatures of habit and we get accustomed to things a certain way. So maybe make a small goal for the week. So decide this week I'm going to eat one more vegetable every day than I have eaten before. Like, maybe you only have vegetables with dinner, maybe you have some carrots or some onion with peppers with dinner. Well, why don't you add, a cucumber with lunch or something like that? Or eat one apple every day this week where you haven't before. Or instead of frying food this week, bake everything in the oven. Just try to make little changes over time. They really do add up and they will make a big difference. But it's hard for anybody to change everything. Like we're not all going to go vegan and just eat raw food. That's not going to happen. We have to make small changes over time. Yeah, and it's not a punishment because I do hear that all the time, like I said, but you have people who love you who want you to stick around for a long time. So it's just not a punishment.
But I love the tips that you suggested because they're so simple, so it seems so simple to incorporate those. Even like what you said, you can take maybe one of your favorite meals and kind of transform it and add a little bit more healthier stuff to it. But some of those tips that you provided, such as maybe eating an apple every day, they are kind of like simple tips and they don't seem tedious. So I want to thank you for sharing that. I want to thank you. It's, like you said, it's the little things and the little steps that we take that matter. So I want to thank you. Thank you so much.
Thank you.
So, yeah, definitely. Thank you. Thank you. And so again, do you have any additional comments as we come near to the end of our session? Is there anything else you would like to add as it pertains to Diabetes Awareness Month, diabetes awareness within our community? Is there anything else you would like to add?
So one of the risk factors for developing type 2 diabetes is just being 45 years old or older. That's all. That's one of the risk factors. So I would encourage people who are 45 or older to make sure that their sugars are tested the next time they go to the doctor. Just ask, hopefully it'll be good news and everything will be okay. But since we know that's a contributing factor, and the earlier you find out if you have type 2 diabetes, the more control you have over the progress of the disease and the longer you can live a happy, healthy life with it. So find out if you can.
Awesome. Could you repeat that? You said could you repeat that? Is very important. Just as simple as being at a certain age, that puts you at a risk. Could you repeat that again, please?
Yeah, so if you're 45 years or older, that is automatically a risk factor for developing type 2 diabetes. And 15 years ago, the age was actually 65 years and older, but it's dropped 20 years and now it's 45 and older. So we also should do whatever we can to make sure it doesn't drop any lower. Or in another 10 years, anyone who's 35 and older is going to be at risk for developing type 2 diabetes. So.
Wow, but if we're looking at 35 and over, that is definitely going to be scary.
Yeah.
Wow.
Yeah.
Wow. And I want to thank you for sharing that. Is there anything else you would like to add as it pertains to Project Hope or any initiatives that you're maybe working on as it pertains to your work with non-communicable diseases or anything else you'd like to add?
Let's see. Well, Project Hope is hoping to stay in the Bahamas for another few years if we can. We have been enjoying our work in Abaco and would very much like to expand the work to other islands as well. So we're working on that. And we also are working closely with the Ministry of Health and hope to continue that close relationship that we've had with them. So I think that's all I can think of, but would definitely like to thank the people in Abaco for how welcoming they've been and how involved they've been with our programs and how supportive they have been as well. And I'd like to say hello to my team in Abaco because it sounds like a lot of them are watching. And I know how hard you guys work and I so appreciate that. Thank you so much.
Thank you, Ms. Nally, and also want to thank you for the work that you and your team are doing as well. Thank you so much for the impact that you're having. And again, thank you for taking your time to share some knowledge with us today. We really do appreciate you. And so I would like to thank you again. Thank you for being a part of this session. And is there a page maybe you would like to share, Project Hope page you would like to share?
We do have a Facebook page, Abaco Community Health Workers. I'll send you the link if you wouldn't mind sharing that.
Yes,
Okay,
that's fine.
I'll do that. Thank you.
That's fine.
Absolutely.
Yeah. And I would like to thank you again. Thank you again for you. Do you have any initiatives coming up you'd like to share?
Well, we're just in week 2 of the 12-week program, so that's what we're focusing on right now. So
Okay.
nothing
Awesome.
else at the moment. Yeah.
Awesome.
Yeah.
So again, thank you. Thank you for being with us today. I would like to thank our viewers for listening in, sharing your comments. Ms. Joseph, listen, I know the food may not be as appealing, but listen, we want to be here for a long time. So we got to do what we have to do. And again, like Ms. Nally said, she gave us some healthy tips. It takes small steps to make a big difference, and maybe adjusting the serving size. And then you talk about another okay, you said it was the thumb for the fat, right?
Yeah,
Like
tip of the
tip.
thumb. That's right.
So you gave us some healthy tips that
Yeah.
we certainly can apply to our lives. So I want to thank you for sharing that knowledge. So I want to thank our viewers for listening in. Like our page for future notifications of upcoming talks. Comment under this video. Let us know your thoughts. Let us know what else you want us to talk about. You can also subscribe to our YouTube channel, Can We Talk, and follow us on Instagram and Twitter using the social handles provided on our page. And again, Ms. Nally, you are welcome back at any time to talk about your other initiatives. I just want to again extend that invitation to you. So with that, we will say good evening, thank you, and can we talk?